Dr. Ryan Cole's medical license in Washington has been restricted by the Washington Medical Commission because of his pattern of dishonesty and reckless disregard of the truth. Dr. Cole, the Garden City pathologist who rose to controversial fame during the pandemic for flouting COVID guidance recommendations like masks and the vaccine, and touting the use of the horse dewormer ivermectin to fight infection. More than 2 years ago, the Washington Medical Commission began investigating complaints against Dr. Cole, saying he was endangering lives for advising the public to not get the COVID vaccine and prescribing patients ivermectin, which is a parasitic medicine, to treat a viral infection. Dr. Cole had his hearing with Washington Medical Commission last fall.
Okay, what harm can you say that Dr. Cole did to others? Specific harm, please.
It's my understanding that he prescribed ivermectin and hydroxychloroquine, both of which were well proven to have no efficacy in the treatment or prevention of COVID.
Dr. Cole has been licensed to practice medicine in the state of Washington since 2007. It was because of that testimony you just heard, and several others, including from Dr. David Pate, the former CEO of St. Luke's Health System and a member of Idaho's COVID task force. The three-member panel decided last week Dr. Cole should not be able to practice medicine or prescribe medication in Washington for the next 5 years.
I started seeing endometrial cancers go up.
For the past several years,
This is a poisonous attack on our population.
Dr. Ryan Cole has traveled the world talking about COVID-19
I don't even like calling it a vaccine, an investigational vaccine.
and the COVID vaccine.
A fake vaccine, okay, I can a clot shot, a needle rape, whatever you want to call it.
Enter an effective prevention and treatment, ivermectin. 100% of the world trials have shown benefit.
Would it be your testimony under oath today that 100% of the world's ivermectin trials have shown benefit?
No. It's my testimony of the trials that I had reviewed at that time that were available in the ever-shifting and changing literature. That's what I had read to that point.
After that testimony, and after reviewing the complaints of several patients and doctors, the Washington Medical Commission concluded Dr. Cole engaged in multiple acts of dishonesty when he made numerous demonstrably false and/or misleading statements in public regarding the COVID-19 pandemic, COVID-19 vaccines, the use of ivermectin to treat COVID-19, and the effectiveness of masks. They even included a few of the false and misleading statements as proof, like ivermectin is a known antiviral medication, the COVID-19 vaccine has caused more deaths than the actual virus and has killed children, and the vaccine can cause cancer and infertility. Dr. Cole was also found to have prescribed ivermectin and other medications to several patients over a telehealth website without examining them or knowing their medical history. So the commission put Cole's Washington license on oversight and removed his ability to practice or prescribe medicine until 2029. His pathologist license remains intact.
Colin.
As usual, we tried to ask Dr. Cole about this decision.
Hi, you've reached Dr. Ryan Cole.
But our phone call, our text message, and our email went unanswered. Okay, so this decision comes with a $5,000 fine, and Dr. Cole has 30 days to appeal for a judicial review. Barring that, this decision also comes with a few caveats. His license on oversight means if he wants to have the restrictions lifted at the end of these 5 years, Dr. Cole must complete medical education courses on COVID-19 and other respiratory diseases, on record keeping and on telehealth within the next 6 months. He must complete an ethics program for healthcare professionals, and he must meet in person regularly with the Washington Medical Commission. He also has to write a 1,000-word paper explaining what he's learned about professionalism, truthfulness, and honesty in medication. You may be wondering here, what does Idaho have to say about this? Because we do know that there were some complaints filed with the Idaho Board of Medicine. Well, we got this response today that under reciprocal discipline, the board may choose to adopt other jurisdictions' disciplinary order as its own, or it may impose its own order and may elect to not impose a disciplinary order. We won't know what they do, but we do know a licensee must note any other prior discipline on an application for the issuance of a renewal of a license here in Idaho. So we'll see what happens, or we won't, with what happens in Idaho.